Victorians will be charged a new mental health tax to overhaul the state's broken system as part of a recommendation by the Royal Commission. Andrea Crothers joins us live now from the State Parliament in Melbourne. Andrea, the Premier has promised to adopt all recommendations.
Well, at least Premier Daniel Andrews certainly has. Now, the Royal Commission's interim report's immediate recommendations include an additional 170 youth and adult acute beds to help respond to urgent demand, boosting the number of mental health professionals, creating a dedicated Aboriginal social and wellbeing centre, as well as boosting outreach and clinical support for those who have attempted to commit suicide. Now, the Royal Commission received more than 8,200 submissions. It spoke to 99 witnesses during those public consultations, and to quote one of those witnesses, the Commission Chair Penny Armitage said, "We don't want to fix a pothole, rather we want a new road."
There's been a long history of underinvestment relative to the need, so we are clear it's a big additional injection on top of the current $1.7 billion that Victoria contributes to mental health services. We think that there is a substantial increase in investment required, both in terms of operating costs but also in terms of new infrastructure, IT and data.
Now, they say that needs to be provided through a dedicated funding stream in the form of a tax. Just exactly what form that would take, well, that's something they're still working on.
We've asked the government to give us some guidance on what form of levy or tax there might be. What form it will take, we don't know.
We are due to hear from Premier Daniel Andrews shortly. He has said already that he will be implementing all of the recommendations. And the final report from this Royal Commission is due to be released in October next year. Annalise?